All right, I'll just get started now. Firstly, on behalf of all the speakers and everyone here today, I'd like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present, and the Aboriginal elders of other communities who may be here today. Good afternoon, everyone. Thank you for joining today's webinar titled Schools and Air. I'm Sabrina Idris, now a Centre for Safe Air affiliate, and I'll be sharing today's webinar. So children spend most of their day indoors at school, yet ventilation and air quality are often overlooked in decisions about school design, maintenance, and health protection. In this webinar, Dr. Bronwyn King and Dr. Mohamed Mahmoud will explore why clean indoor air should be considered essential infrastructure in schools and what practical steps can be taken now. Each speaker will present for up to 20 minutes, followed by a Q&A after all presentations have ended, so please drop your questions in the Q&A section. Our first speaker is Dr. Bronwyn King, who is a global public health leader driving international action on healthy indoor air as a core pillar of prevention, climate resilience, and pandemic preparedness. She is the co-founder of Air Club and has convened landmark high-level dialogues on indoor air quality at the UN General Assembly in New York and during the recent One Health Summit in Lyon, working closely with the French G7 presidency. Previously a radiation oncologist, she founded tobacco-free portfolios, mobilizing over 18 trillion US dollars in capital away from tobacco. A former elite swimmer who represented Australia, she brings the same determination to improving the air we breathe indoors. Over to you, Bronwyn.
Thank you very much, Sabrina. I'm just going to get my screen set. Is that working for you?
Yeah, looks great. Thanks, Bron.
Fantastic. Thank you very much for having me here today. It's a great pleasure to speak about this really important topic. I'll jump straight in to say that children spend 7 hours a day, 5 days a week during school terms at school, and that accounts for around 20% of their total time during school weeks. So it's a lot of time. In the UK, there was a very nice estimate that during their entire school lives, from the age of 5 to 18, children will breathe around 7.2 million litres of air at school, or a nice way to think of it is 90,000 bathfuls of air. So clearly, the air children breathe at school has a significant impact on their health. And while air is usually invisible, when measured, indoor air quality is frequently found to be poor. It's frequently full of pathogens like bugs, bacteria and viruses in the air, and pollutants like vehicle emissions, dust, smoke, dangerous chemicals, and even microplastics. There are numerous studies, including one from the US EPA, that suggests that indoor air can be 3 to 5 times worse than outdoor air. And schools, many studies show that schools frequently have poor indoor air quality compared to other indoor environments. So it really is important that we act on this issue. I've shown here some indoor air quality measurements as a parent that I have got because I've sent my kids off to school with air quality monitors, like if you can also see me there, like these little Aranet 4s, which just measure CO2 in the air, which is one of the important things to measure in the air because it's a proxy for ventilation or how fresh the air is. Now, these recordings show the CO2 over the course of a school day. Now, ideally, the CO2 should be less than 800 parts per million. If it's over that, then you will see red on this graph. So this one is a recording from one of my sons from last year showing that he spent a significant portion of the school day in the red zone with levels up to 1,000 parts per million. This is on the same day, but my other son, who spent almost all of the school day above the red zone with levels up to 2,000. This is another day where the levels were up to 3,000. And this was on the second day of school this year in 2026, when one of my sons spent the entire day in the red zone with levels up to 4,000 parts per million. So clearly there is an issue in schools with clean air. I'd like to also compare that to, this is a typical weekend day, showing that schools really do represent a high risk place for children when it comes to clean air. If we look at sort of some of the overarching laws, standards, and policies, there are existing documents and laws in Australia at a state and federal level from an occupational health and safety point of view that clearly establish that schools are legally required to provide safe and healthy environments. Now, in addition to that, there's another overlay of regulation, including state and federal laws, that outline that schools must be inclusive and accessible. And by that, I mean that they must make efforts to remove barriers to access, and they must make reasonable adjustments so that all children can attend school safely, regardless of whether that child has a disability or some kind of chronic illness. This is a very nice Swiss study that was done looking at the transmission of airborne disease during the height of the COVID pandemic. So COVID is an airborne disease, and this study looked at the infection rate of the general population, which is on this arm of the graph, compared to the infection rate of school children. And the most interesting finding was that during the Delta and the Omicron era of COVID, the risk of getting infected if you were a school child was 2 to 5 times higher than the risk of being infected if you were just a general member of the community. So schools are risky places for airborne diseases. This is also a fabulous graph or fabulous little image that I really like, that shows that there are impacts of school infections that go beyond the school. This was an Italian study that looked at transmission of COVID. On this little chart here, people are represented by dots. People with COVID are the orange dots, people without are the blue dots. And school-based transmission of COVID is indicated by these sort of yellowy light orange lines going from one dot to another. And you can clearly see here that these school-based transmissions with lots of yellowy lines typically resulted in clusters of infections that went well beyond the household compared to when COVID was acquired in a different setting. So this really shows that school transmission of airborne diseases really drives community transmission and has broader impacts than just the school. So why have we got a problem with indoor air quality in schools in 2026? The reason is that we have no indoor air quality standards, no health-based indoor air quality standards that apply to public buildings in Australia and in most parts of the world. This really represents a big gap in our public health frameworks and a huge opportunity to improve the health and well-being for the community if we can act. If we look now at the benefits of healthy indoor air in schools, there are many, and I'd like to start with health, focusing on acute illness first of all. When we look at airborne diseases, there are lots of them that most people will know: colds, influenza, RSV, COVID, and these collectively are in fact the leading cause of illness-related absence from school. And this study last year that was done, this is a Dutch study, published 2 years ago, showed that the vast majority, 66% of illness-related absenteeism was due to airborne diseases. So if we can reduce this and do that by improving indoor air quality, we can have a substantial impact on improving school attendance. If we then look at chronic illnesses, and the first one I'd like to address is asthma, the numbers are alarming. So 1 in 10 Australian school children suffers from asthma, which is 400,000 Australian kids. It's clear that poor indoor air quality makes asthma worse. Estimates from around the world suggest that 30 to 40% of kids with asthma will miss school because of an asthma flare-up, and on average they miss 4 days per year. So a big opportunity to really address a problem that impacts a very substantial number of children. If we look at long COVID, some studies suggest that it now may be almost as common as asthma. So around 5 to 10% of children have some long-term impact from a COVID infection. It could be a reduction in the strength of their immunity, heart impacts, neurological impacts, fatigue, lung impacts. And many people ask, can we prevent long COVID? And the answer is yes. You prevent long COVID by not getting COVID in the first place. And what about COVID reinfections? For all people, they should be avoided. Even if you've had COVID and had no long-term impacts with that infection, your risk increases with your next infection. If you already have some long COVID symptoms, absolutely you don't want to get COVID again to really set back your recovery process. And what about other chronic illnesses that make kids or teachers more vulnerable to the impact of poor air quality? There's a whole big list of them here. It's not exhaustive. But the point is, there's no chronic illness where exposure to airborne pathogens or airborne pollutants is a good idea. When it comes to absenteeism, as everyone knows, across Australia, across the world, school attendance for children dramatically fell in 2020 and 2021, and it never recovered. So we now have persistently higher absenteeism in Australia. This is a national concern. And studies in Australia show that it's largely driven by poor health. Now, that could be recurrent illness, chronic conditions, or mental health. So airborne diseases are not responsible for all of that, but they are responsible for a substantial portion of that. When we think about absenteeism, some people think, oh, it's just a day here or there. But in fact, every day of absenteeism impacts children in the long term. So there's studies, this is from the Melbourne Institute of Applied Economic and Social Research. This is just one of many, many studies showing that absenteeism impacts lifetime earnings and has lasting economic consequences. When we think of clean air, we often think of sort of physical or mental health impacts, but in fact, there are learning impacts, cognitive impacts as well. And so during the height of the COVID pandemic, experts from all around the world were invited to develop this Lancet COVID-19 Commission. It was a special task force on safe work, safe school, and safe travel. And it was developed for governments to give them advice on how they could get children back into in-person learning in a safe way. Now, the key findings included that improving indoor air quality substantially reduces the risk of airborne disease. Many of the interventions and solutions are low cost, and treating indoor air quality in schools as core health infrastructure rather than as a luxury item or as a nice to have can deliver long-term benefits. In addition, there were a whole range of cognitive benefits for the child. And I got out my highlighter and thought, I'll just highlight the important ones here. And I ended up highlighting every single one because I think if you speak to a parent and ask them if you would like their child to have better test scores in maths and reading and science, better cognitive function and the ability to focus more, if they're an asthmatic, to reduce their asthma symptoms and respiratory symptoms, to reduce illness overall, and to reduce missed days, everyone would agree that this is a good idea. So in a nutshell, clean air makes clever kids. It reduces illness, improves absenteeism, and it improves cognitive function. There are a couple of other studies I wanted to pull out because I found them so interesting. This one is a study that showed that even short-term exposure to air pollution on your exam day significantly reduces the test score. So when we're sending off, our more senior students to do exams that are very consequential for their future in terms of getting into university and getting good jobs, we really need to be making sure that they do those exams with great air quality. This study looked at installing air filters in schools. It showed an 8% gain in scores for maths and English, which is terrific. The cost was only $30 per student to do that. Now, the same effect could have been achieved if they employed more teachers and reduced the class size so each child was getting more attention, but that would have cost $7,000. And so this study concluded that air filters are 230 times more cost effective than reduced class size when it comes to improving your kids' marks. So I think that's a really interesting result and should provide lots of food for thought. When it comes to economic impacts more broadly, clearly teachers are a foundational part of the school ecosystem. And like students, they had a huge rise in absenteeism due to illness in 2020, 21, and 22. And again, that remains higher than pre-2019. Airborne disease is a leading contributor. That's according to multiple data sources from the US, UK, and Australia. And if we just look at Victoria, in just 1 year, $366 million was spent on Victorian relief teachers, $1 million a day. Now, obviously, not all relief teachers are there because of the teacher having an airborne disease illness, but a substantial number of them are. There's also parents in the school ecosystem. And if we look at data from Australia and the OECD, we know that illness-related school absence drives substantial parental workforce absence. So parents have to take the day off to look after the sick child. Often this is women. And this has also substantially increased since the arrival of COVID. In terms of the amount of money involved in this and the financial burden, there is data from UK modelling suggesting that each year approximately 8 to 13 billion pounds, that converts, you double that to get Aussie dollars, so say 16 to 26 billion Aussie dollars per year is spent in the UK because of the impact on parents because the kids are sick. So if we look at a couple of studies that provide great evidence that clean air is good for schools, there's this very notable 2022 Italian study. It looked at 10,000 classrooms, over 200,000 students, comparing mechanical ventilation with natural ventilation. And it showed mechanical ventilation offered up to an 80% reduction in COVID infection. This was in the height of the pandemic. And the authors of this study concluded that public authorities should guarantee that schools are mechanically ventilated, which is obviously a very strong recommendation. And even though most schools would love to do that, there is a cost factor there, and not all schools would immediately have that money available. The good news is that there are many simple interventions that can be effective. And this study was from the CDC, published in 2021, showing that there are low or no cost interventions that are also substantially beneficial to improve air quality in schools. And this ranges from things like behavioural changes, like using larger rooms or taking classes outside where possible, to simple things like opening doors and windows or installing portable air purifiers. When we look at randomised controlled trials that give us evidence on indoor air quality in schools, there's this study looking at 95 primary school classrooms that looked at HEPA purifiers versus no HEPA purifiers. And it showed that those with the purifiers had a substantial reduction in absenteeism, a reduction in airborne pollutants, and the economics were favourable with a 1 to 10 cost-benefit ratio. There's also this very neat study done from Finland. It was 2 daycare units were fitted with portable air cleaners, and they were compared to all other daycare units in Helsinki. And the findings showed that there was a 32% lower parental absence from work due to caring for a sick child, which is really a reflection of how much sickness was there in these daycare units. So there's terrific evidence that, yes, we have a problem in schools, but we also have solutions that work. I also wanted to just mention some great examples from around the world. So 4 years ago, the SAMI research study started in the UK. So far, the data has been analysed on 346 UK schools, and they looked at indoor air quality monitoring and related it to health and other impacts. And these are some key findings. Ventilation rates in UK classrooms are routinely far below other workplaces, even though over 1 million staff work in UK classrooms. And improving air quality reduces illness-related absence and is feasible, scalable, and cost-effective. They also determined that simple interventions like air purifiers work well. Montenegro deserves a shout out for being a wonderful leader in this space. This is a quote from the Montenegrin education minister at a UN event last year, and she's announcing here with great pride, we are announcing the Montenegrin Initiative for Clean Indoor Air. It's more than a project, it's a national commitment, a statement that clean air for every child in every classroom is a right, not a privilege. Wonderful action and leadership there from Montenegro. The Mayor of London, Sadiq Khan, here's a quote following the announcement that he was going to invest £2.7 million in installing air purifiers in some London schools. And the quote's terrific. I want every single child to breathe clean air in and around their school. In those vital early years, the difference this can make to young people's health and well-being can be life-changing. And we certainly hope to see that terrific program expand in future. There's a wonderful example of the Boston Schools Public Program, and that is Catherine Walsh, the director of the program, that saw in 2021 every Boston public school, over 120 schools, every classroom, hallway, and nursing station was fitted with live indoor air quality, real-time indoor air quality monitoring, and air purifiers. The Victorian government is leading the way on this issue. It's fantastic that they invested $10 million in the Pathways to Clean Indoor Air in Victoria project. This is being led by Burnett Institute and a number of collaborators. And it's a 2-year research project looking at schools and public buildings, testing solutions to improve indoor air quality. When it comes to Australian examples, I recently found this one, and I wish it wasn't only private schools, but Somerset College, which is a private school in the Gold Coast, has recently made an announcement that they have implemented real-time CO2 monitoring in classrooms. They've partnered with leading air quality experts, including Professor Lydia Morovska's group at QUT, and pleasingly, they've integrated teaching and education about indoor air quality into their STEM programs and climate awareness. And when it comes to bringing kids into the conversation, there are definitely some fun and innovative ways that can be done in the classroom. So overall, when we look globally, there are now 24 countries that are acting on indoor air quality in some way. Some of them are doing research projects, some are deploying air quality monitors, some are installing air purifiers, and some are working towards or have already implemented legislation. Last year, we launched, along with Dr. Georgia Lagoudis and many collaborators, we launched the Global Pledge for Healthy Indoor Air at UN headquarters. As of today, we have almost exactly 250 signatories of that pledge, and it's pleasing that many of them are schools from all around the world. And finally, we would never accept sending our kids off to school if we knew that they were going to be served dirty water during school hours. And we shouldn't rest until we're confident that our kids are breathing clean air all day at school. Thank you very much.
Thank you so much, Bronwyn, for sharing such valuable insights about the air quality in schools and its impacts. There are no questions in the chat yet, so attendees, please drop your questions in the Q&A section, and we'll get to them after Mohamed's presentation. Our next speaker is Dr. Mohamed Mahmoud, who is a research associate in the School of Mechanical and Manufacturing Engineering at the University of New South Wales. His research focuses on indoor air quality, ventilation design, and airborne infection risk modeling in built environments, with an emphasis on assessing the effectiveness of ventilation and filtration strategies to ensure safe indoor air quality and minimize infection risk. Mohamed specializes in the use of computational fluid dynamics to simulate aerosol and carbon dioxide transport in indoor spaces, with a particular interest in classrooms, aged care facilities, and healthcare settings. His work includes advanced modeling of respiratory aerosol emissions as multi-phase flows generated by human activities such as coughing, sneezing, and breathing. Over to you, Mohamed.
Thank you. Okay, do you see my screen?
Yes, but yeah, I can see it now. Thank you.
Okay, so first I would like thank you for your introduction. So I would like first to acknowledge all the scientific people who have been working in this project from University of New South Wales, the School of Engineering and Curtin Institute, and also the fund was part of our research. So let's try to give you an idea about what I'm going to talk about. It's how poor air quality can contribute to the disease, airborne transmission disease. So you can imagine for a given school, as you can see in this slide. So let's imagine the teacher is infected and he's exhaling CO2 and particles, and these particles or aerosol containing the virus in it. And we have students who are susceptible people for this infected person. And we have also something like air conditioning system, HEPA filters, and windows and door. So we need to understand the connections or the relationship between how this infected person will exhale the virus and how it will be spread. So the connection also between the air quality and the airborne disease transmission. So it's not only about what should be the minimum CO2 threshold or what should be the minimum aerosol concentration in the air, but also we need to understand the infection risk and the occupancy time map. And this is what I'm going to talk about. So first, I will try to give you introduction about the experimental setup we did in the classroom environment in Sydney, and I will show you the CO2 and aerosol concentration, infection risk, and occupancy time for still air environment and the classroom with HEPA filters. So let's start with the classroom we did before. So as you can see in the right-hand side, this is the classroom settings. So we asked about 22 participants to come to this classroom environment, try to mimic exactly the real setting of a classroom in this room. And as you can see here, we have a HEPA filters and we have some kind of sensor to measure this aerosol and CO2 concentration. And the picture on the left-hand side showing how we replicated these real settings in the computer simulation using computational fluid dynamics. So this is how the participants arranging seating in this room, and they have been asking to just talking and breathing, and we try three different scenario. So the first one is called still air. So we need to know how the air quality looks like inside the classroom. If you have a push fire and you have to shut the windows and doors and everything. That's why we did the first experiment as a still air. So no ventilation, no filtration, and windows and door are closed. So we have only the participants, only breathing and exhaling CO2 and aerosol. The second two scenario, it's what should be in the same condition, so windows kept closed and doors. But at this time, we just turning on the HEPA filters, and we need to understand what HEPA filter it's gonna do with air quality, the CO2 dispersion, and the aerosol. So we have one scenario with one HEPA filter at the corner, and the second one with three HEPA filters at different positions in the room. So we need also to understand what is the impact of the number of filtrations and also the clean air delivery rate for each one. So regarding the sensor we used, so we use the RNet4 sensor to measure the CO2 concentration. And regarding the aerosol concentration, we use something called TSIOPC. It's accurate measurement of particle concentration. And also we used a clarity sensor for it's a low-cost particle counting sensor. So by this sensor we can measure the CO2 and the aerosol concentrations. So let's start about in the case of bushfire and you keep everything closed, how the air quality looks like inside. So this is the reading we got from the sensor. This is at only one locations. So the green line showing the CO2 accumulation with the time. So based on this, because we don't have ventilation, so it's obviously clear that the CO2 was increased dramatically and exceeding the 1000 ppm threshold after 9 minutes. And if you look at the new recommended threshold by Professor Lydia Moriska, which she mentioned that keep the CO2 below 800 ppm. So as you can see, it just got this level in 3 minutes. And this showing how bad is the air quality in the room if you don't have ventilation or filtrations. And this is the case of the bushfire and all schools closing and shutting all the windows and doors. And also, if you look at this red line showing the accumulation of the aerosol, so also because we don't have the filtration, so it's obviously clear that we have increased also in the aerosol concentration. So this is only mainly the data at the sensor location. Let's look, use the computer simulation to see how this dispersion looks like everywhere in the classroom. So this is showing the vertical contours of the CO2 concentration, and the same for aerosol, because we need to understand what is the thermal stratification or how the distribution looks like around the person. As you can see, we found that the CO2 at the ceiling level is a 400 ppm higher than at the lower level. And this gives us important recommendation that it will be better to install all the sensor at the breathing level. And this is because all the CO2 and aerosol exhaled from the person, it's ascending upward due to the thermal plume generated from the occupant. And this is the same behavior for aerosol. So most of the ceiling accumulating the aerosol, and then later it will be descending down. And when we look at the horizontal distributions of the CO2 at different height above the ground, so this is for CO2 and this is for aerosol. So as you can see, obviously clear that we have a propagation, so accumulation of the CO2, it's basically above the person in the ceiling level. And also we found that most of the exhaled CO2 and aerosol, it's accumulated around the person because as I've said before, we don't have ventilation, we don't have filtration. This means we don't have any source of airflow inside the room. And this showing the accumulation of contaminants around the person. And this is animation showing how the CO2 exhaled from from the students are accumulating and spreading everywhere in this room, and showing you how dangerous if you have this kind of scenario where you are closing the window, closing the door, and also you don't have any source of ventilation or filtration. Therefore, based on our study in the still air environment, so it's recommended, as you can see, the CO2 level will be exceeded the recommended threshold in 3 minutes. So this is showing how dangerous air inside this type of classroom. And also, if you have a sensor inside, it's recommended to install it at the breathing level, because based on the thermal stratification we have seen, CO2 it's basically accumulating upward, and this is particularly for this scenario. So now the second step in the same condition, so window closed, door closed, let's see if we turn on the HEPA filter, what's gonna do with the CO2 and aerosol. And this is what I'm talking about now. So we compare the CO2 and aerosol concentration from the sensor at different settings. This is the still air I've showed you before, and this is for one HEPA filter, and this is for three HEPA filters. So as you can see for the green line, this is accumulation of CO2. So it's still among all scenario, even when we have HEPA filter, it's increasing with time. This is because we don't have ventilation. So this showing that HEPA filter has nothing to do with CO2. But as you can see, after the time history, we'll see that the CO2 at the end, it's lower than if you don't have HEPA filter. And this showing that HEPA filter as this scenario is behaving as a fan, dispersing the CO2. But if you look at the aerosol concentration, so when you have one HEPA filter, we have a slight reduction in aerosol. And when you have three HEPA filter, it's efficiently reduce the aerosol concentration, as you can see from the sensor. So now let's look at how this CO2 dispersion and aerosol everywhere in the room when using CFD simulation. So this is a CO2 contour map at the breathing level of the students. As you can see, most of the CO2, as I've told before, it's basically accumulated around the person. But when you have one HEPA filter, the discharged airflow from the filter, increasing the mixing intensity of the CO2. So this showing comparing still air with one HEPA filter. So this is could be good from CO2 point of view. So instead of the students are breathing high level of CO2, but the HEPA filter at this time behave like a fan and just try to disperse the CO2 away from the breathing zone of the person. And the more filter you have, you will see high dispersion intensity. So this is for CO2. So for CO2, it's not overall decreasing the CO2 in this room, but at just decreasing in the breathing level. And for aerosol concentration, so when you have one HEPA filter, we see a slight reduction in aerosol concentration. And when you have HEPA filter, we have a great reduction in aerosol concentration. So from this, we can say that HEPA filter, as you see in the literature or industry, it's efficiently can be used to reduce the aerosol concentration, but not for CO2. Just for CO2, just behave as a fan dispersing the CO2 everywhere. But the main question now, even if we have three HEPA filter, when we have this low level of aerosol concentration, So let's get back to the question I asked before, the relation between air quality and the airborne disease transmission. Do you think this low level of aerosol it's enough to say this room environment is safe? So can I say that students can stay safe for this environment for a long time without being infected? Because if we have one infected student, he's continuously exhaling the virus. So all the susceptible students surrounding him, he will inhale this kind of virus. So as long as he is inhaling the virus and until he's reaching the enough dose to make him infected, he will be infected. So we need to calculate the time. That's why we developed infection in risk model. This model is capable to connect the aerosol concentration data from the sensor, couple it to the model, and this model can be used in different application. It can give you the time the filter take to reduce the aerosol. It can also provide you like calculate the infection risk and also can calculate the occupant's time map, how long the student can stay safe without being infected. And the second approach, this model can be used if you have safety simulation to have this kind of maps. You can use safety simulation and apply the same model to give you this map, probability of infection and occupant's time map. Of course, if you have multiple sensors in the room, you can have the same information and you can have the same map. So let's see how this model can be used to estimate because most of the people are using HEPA filter but they don't know actually how long the HEPA filter you have in the room take to reduce the aerosol concentration and what should be the minimum aerosol concentration this HEPA filter can achieve because as I've said before, you have people are continuously exhaling the virus. So this means that exhaling CO2 and aerosol. This means that whatever the power of or the clean air derivative of the filter, you reach a certain point, a minimum aerosol concentration. So we need to calculate this value and also know the time. So C node here is the background concentration. It's the initial, this is the time at which you turn it on the HEPA filter. So in this scenario, we assume that the students came into the classroom and then we turn it on the HEPA filter. So the HEPA filter will start to decrease aerosol from C node. And the black line, this is mainly for the SEPA filter. So as you can see, the higher filtration rate, it takes about 45 minutes for the SEPA filter to reduce the aerosol concentration and about 6 hours to reduce the aerosol concentration. This means that the higher ventilation rate is the lower is the time to a bridge. So this model is capable to estimate the effectiveness of the filter. It can give you the time the filter is gonna take to reduce the aerosol concentration and also it can be used to calculate what will be the minimum aerosol concentration the HEPA filter can achieve. Because based on this value of aerosol concentration, this is that will be continuously inhaled by susceptible students and at certain time he will be infected. So the next step to know how long does it take for the student to be infected, even if the HEPA filter you have approaches this value. So the model first calculates the probability of infection. So this is for the stale air and one HEPA filter and SEPA filter. So the HEPA filtration, as I've said before, it's try to decrease the accumulations of contaminants around the students. And when you have two HEPA filter, it's try to trap all the contaminants, the aerosol concentration between these two filters. But when you look at this kind of probability of infection map, it doesn't give you more information because we don't know still if it's safe or not. And we need also to give some interpretive information for people to know or public to know how can this information can be used. How because I need to understand. Okay, even at this position, can I stay for the classroom period without being infected? This is the question. That's why we made this occupant time map. So we assume that only one student at this location is infected and he's exhaling the aerosol with virus. And here I'm calculating the infection risk and occupants time related to COVID-19. And this is for still air. As you can see, most of the exhaled aerosol it's trapped in this area on the left-hand side. And as you can see, all the students in the right-hand side can stay safe without being infected. So you can imagine you have a classroom, and the classroom period is about 25 minutes. The class time is 25 minutes. So based on this scenario, we can say that all about eight occupants or students can stay safe without being infected. But when you have one HEPA filter, this is interesting to know that Unfortunately, we have no occupants can remain safe for 25 minutes. We have only 10 for 18 minutes compared to 12 for um, without HEPA filter. And this is unfortunately because based on the relative position between the HEPA filter and this infector, the airflow discharged from the filter behave like a fan, dispersing first the exhaled virus everywhere in the classroom before being infected. And this is so HEPA filter, it's reducing the aerosol concentration, but unfortunately, it's behave like a fan and increasing the mixing intensity of the exhaled virus. And this is, of course, not a good idea about this. And when you have three HEPA filter, as you can see, because we have two HEPA filters, so all the aerosol exhaled from the infector try to escape to right hand side, it will be extracted directly from the filter at the center here. So based on this arrangement of HEPA filter, it's tried to trap all the exhaled virus between these two HEPA filters. So, so as you can see, based on this scenario, comparing HEPA filter with a stair, we have 17 safe occupants of 25 minutes. So the main question is, it's not about how many HEPA filter you're using or what should be the clean air delivery rate, but how did you use it? Like what should be the arrangement or the orientation of the HEPA filter relative to the person. And we tried another scenario to give you an idea about how the arrangement looks like. So this is still here as well, but we changed the location of the infected students. And in this case, we have 14 safe occupants so all the people surrounding the infector will be infected, and all the people away from him are unlikely to be infected. And unfortunately, also with one HEPA filter, so the filter it's far away from the infector, and the air, the discharged airflow is behave like a fan and dispersing the aerosol everywhere before being extracted. And when you have three HEPA filter still, it's not the exhaled or the source of infection. It's far away from the intake. So as you can see, these two HEPA filters try to trap the virus between this area, but still, even with the HEPA filter, it's not efficiently used to extract directly the exhaled virus from the air. Even this HEPA filter reducing the aerosol concentration, but as I've said, the infector is continuously exhaling the virus, so you will have a certain dose. It's low, but at certain time you'll be infected. So we need to reduce the aerosol concentration and also eliminate the dispersion. And another scenario with this occupant in this area. So again, if the infector positions in this place, so even the HEPA filter, it's close to him, but the problem again is that this is charged airflow try to disperse the aerosol exhaled everywhere in the room before being extracted. And this is a problem of the orientation and how you implement the HEPA filter in a proper way. And this gives information that it's important to make sure that the intake of the filter it's pretty close to the exhaled virus, to the infector, and try to keep students away from the outtake or the discharged airflow. And can be clear in this scenario. So when we assume that the infector is positioned in this place, so when you look at the Saber filter, so you can see all the exhaled virus will be directly extracted through this filter, and we have elimination dispersion. So from this, it's not basically about the number of filters. So it's good we have more filters to try to balance if you don't have different infector scenario. But the most important thing is how the orientation looks like relative to the infector positions. And this gives us information that we should keep students away from the discharged airflow. So the conclusion is the model is capable to look at estimate the effectiveness of HEPA filter, and we can tell even with this low aerosol concentration achieved by the filter, we can tell if it's safe or not based on the infection risk and the occupant's time map. And we can measure how long the filter is going to take. And also, as I've seen before, it's important. And crucially, if you have HEPA filter in the room, it's important to turn on the HEPA filter before letting students entering the classroom to reduce the background concentration as much as we can and try to reduce the steady state time that the filter is going to take to reduce the aerosol concentration. And as I've seen, this low amount of clean air rate with this one filter at this position is not enough. And as I've said before, the key factor is not the number of filter you're using, but the effectiveness of the placement. The placement effectiveness, how is the relative position between the intake of the filter and the source. And so I would like to do some advertisement about our coming workshop announcement. It's gonna be in November in University of New South Wales, and at this time we're gonna talk about the recent research about indoor air quality, not only in classrooms but aged care facility and hospitals. So if you are interested, you can reach out, Nina. Thank you very much.
Thank you so much, Mohammed, for showcasing your amazing research. So now we'll open the floor for any questions that the attendees may have. I'll start with Bronwyn. There is a question about fragrances and toxic chemicals. So someone has said that the fragrances and toxic chemicals used within schools are used pervasively and are known toxics that impact on immune and other biological systems in children. Do you know if there are any actions being taken to reduce these things in the indoor air quality movement, as air filtration and ventilation alone will not improve these things?
Yeah, look, I think it's a great point. And I mean, there's a question further down from the same person just outlining that other countries have acted on this. So, other countries have fragrance-free environments in various places, but including in schools. And I think it's a really important point. There are people with all sorts of chemical sensitivities. There are children with allergies, and yet it's quite it's really an unregulated issue. And we certainly, can learn from other jurisdictions about that. And it's something that we definitely need to incorporate into our thinking when we're advocating for indoor air quality improvement.
Thanks, Bronwyn. So I think there's a question for Mohammed. So does the carbon-based filtration support removal of VOCs as well? Systems such as IQ Air and Innova Air Filtration claim to address VOCs, pathogens, carbon dioxides, and other pollutants. Are these being implemented in your school projects, and are you using systems that primarily target pathogens and CO2?
Yeah, thanks for this question. So actually, we basically measured the CO2 and the particle concentration, the aerosol, using the sensor I showed before. So we didn't measure the VOC. But in the aged care facility and the classroom, we measured also some the bioaerosol. So we measured the virus itself, the COVID-19 virus. And this is will be presented on our upcoming workshop. But for classroom, we just measure the CO2 and particles concentration, and we just use the infection and epidemiological data regarding COVID-19 from literature, and we just develop this our infection risk model to estimate the infection risk regarding this. Yeah.
Thank you, Mohammed. The next question goes to Bronwyn. Someone has said that many preschool childcare centers are located on busy roads. Do you have any insights into the exposure of these preschool children to traffic air pollution?
Thanks for the question. I think it's a really important point in terms of vehicle emissions and how they can affect children at school. There is a wonderful campaign called, hang on, it's just escaped me. It's called Idle Off, that Claire Walters is running in Australia at the moment, which is to encourage parents when they drop off kids or go to collect them in the afternoon to not have the ignition running, so that children are not exposed to so many vehicle emissions during drop off and pickup time. But what about schools that are on busy roads or near freeways or in very built up areas in cities? This is an issue that is really important. And it's not just about exposure in the outside areas around a school, because all of that air goes into the school, leading to significant vehicle emission exposure during class time as well. Some great programs have happened around the world, in particular in London, Paris, and New York, where schools have now got areas around them where cars can no longer go during drop-off and pick-up time. So there might be I think, like a 100 or a 200-metre area where you can no longer go, so that it reduces the amount of exposure around the school. But in addition to that, there are programs like the one I mentioned in the City of London, where air purifiers specifically to reduce vehicle emission vehicle emission exposure are being installed in London schools. And so I think, when we think about it more broadly, there's no downside to improving air quality and to implementing air quality solutions in schools, because we will deal with all of these different pathogens and pollutants at the same time. Obviously, there's a range of solutions out there, but the bottom line is there are lots of airborne hazards in the air, and taking steps on indoor air quality will benefit children, staff, parents, and the school community very broadly.
Thank you, Bronwyn. So the next question comes from Christopher. I think either Mohamed or Bronwyn can answer this one. So he said that our school's PNC association wants to monitor indoor and outdoor air quality. What system or equipment would you recommend? And is there any support available from government or other organizations?
Mohamed, would you like to? I could make some comments on that, just to say, as far as I'm aware, there aren't any specific funding opportunities. I'm not aware of any at the moment, but hopefully once this pilot program, the Pathways to Clean Indoor Air in Victoria, hopefully once that's finished, we will see a much broader rollout in Victoria of improved air quality systems. But for some guidance, I've just sent a link that I'm not sure if you can distribute to everybody. The Victorian government does have a terrific sort of outline of ventilation and air purification advice for schools that is on the Victorian government website. So it's definitely a great place to start. But in terms of the very specific which air purifier, where you put it, I will hand over to Mohamed, who's the tech expert on that.
Yeah, thanks, Bronwyn. Regarding these questions, I think it's important to monitor outdoor and indoor, and this is what we have already done in our classroom settings to have an idea about what is the background concentration or the initial concentration of CO2 and aerosol we have in the room inside. And based on this, we can have this time history of CO2 and aerosol. And from this data, we can have an idea about the number of students there, and we can obtain something, the data such as the air change per hour for the ventilation or filtration settings. So it's important to have both settings, and maybe you can use the sensor we used in our study. But regarding the funding and this stuff, I think Purnun covers this one. It could be from the government or it could be from the private school.
Thank you, Mohammed and Bronwyn. So the next question comes from Michael. He said, thanks for drawing our attention to the economic literature, Bronwyn. One of our Centre for Safe Air investigators got EU funding to investigate health benefits of air purifiers in schools. These were rapidly rolled out during the pandemic, but now sit mostly in cupboards. However, the education department and Catholic education have refused permission to conduct the study in their schools. Do you have any suggestions?
Oh, look, it's so frustrating when the people that you need to act on this are not listening. But I think take heart, Michael, from the fact that there is a growing global community of advocates and experts that are really trying to uplift awareness and drive action on indoor air quality, because it is, I think, at the end of the day, there is a problem with indoor air quality in schools. By and large, it's poor. And every day that we send our kids to school, we're exposing them to unsafe air, which is unacceptable. And in fact, there are laws and policies and standards in Australia that really suggest that this is an issue that should already be addressed, but certainly it's one that should be prioritised now. We do have solutions, and there's lots of evidence from all around the world that shows that there are solutions ranging from very simple and low cost to medium cost to more substantial. But there are returns on investment. And I mean, I just showed one study that showed $1 in gives $10 back. There's many studies that show a return on investment, even one in the US that showed for businesses, the return on investment can be $1 in to $200 of savings. So the economic benefits are there, and they're shown time and time again. In terms of persuading people, this is why really we launched the Global Pledge for Healthy Indoor Air at the UN, because we feel that united we can achieve things more quickly and more comprehensively. There are 250 different organisations that have signed the pledge. These include schools, academic institutions, businesses, community groups, health groups, and countries. So France and Montenegro have signed the pledge, and we're busy engaging with more than 24 other countries to encourage them to do it as well. So aligned, coordinated advocacy, keep your spirits up, and it's I'm sending all my good wishes to you, and I hope that you can get a breakthrough soon for your school.
Thank you, Bronwyn. The next question goes to Mohamed. So Mohamed, you said that the orientation of the HEPA filters is important to minimize infection risk. Do you know how should the HEPA filters be positioned? Should we use different HEPA designs? What are your thoughts on that?
Thanks for this question. So yeah, orientation, it's matter much, and each filter has a different design, and of course it will has a different result. So the thing, as I've said before, our model is capable to know if the filter you have is good or not. And but based on our results so far, I can tell that try to make sure that position the intake direct to the students, and try to avoid all students to be close to the outtake or the discharged airflow. Because as I've said before, we need to make the discharged airflow away from that person or the exhaled contaminants from the person. So orientation is matter, and the HEPA filter design is matter. Where is the intake? Where is the charge? And also what is the discharged airflow velocity? The minimum is much better. Yeah.
Thank you, Mohammed. There's a question from Jeff. He said that one important factor that he didn't pick up was the HEPA throughput versus the classroom air volume. Do you have any findings that describe their effect expressed as air changes per hour?
Yeah, this is a good question. So actually, we consider the clean air delivery rate and the classroom air volume. So as I've showed you in the table, I mentioned what is the clean air delivery rate for each filter. And regarding the ACH, so the classroom we did, we doesn't have any ventilation system. So the air change per hour, it was a minimal due to the leakage through the three small vents at the ceiling, and it was about 0.28 ACH. And the clean air delivery rate, it was about 300 for one air filter, and the other two was 700 meter cube per hour. So we have a correlation, of course, between because this is important to calculate the infection risk and the removal rate of the aerosol. And this is, of course, can be you can look at this result in my PhD thesis. I added the reference in my slides. Thank you.
Thank you, Mohammed. So we're reaching to the end of the webinar, so this will be the last question for Bronwyn. So what actions did you take after learning that your children were exposed to CO2 levels above the threshold at school? And Melissa is asking, how can parents approach reps in government to help? Who can we go to?
Well, look, I think it's a great question in terms of who can we go to. I mean, the wonderful thing of democracy is that everybody gets to have a say, and your government representatives are representatives for you and your community. So absolutely, you can go to your state representatives and your federal representatives and ask for meetings. If you can organise as a group, that's even better. And of course, when you're advocating for schools, the most important thing is to go to the schools themselves, to their leadership, to the boards, the parent committees, and explain that there is a problem and that there are solutions. And it would be very reasonable to explore those solutions and see if we can make the whole school community healthier. So I think, I certainly wish everybody well who's on this journey of trying to advocate for improving indoor air quality in schools. It isn't easy. Sometimes there are school leaders that they don't want to listen, or they're not ready, or they're simply unaware. And I think for most of them, I think the lack of awareness is the key. So, let's stick together and try to educate those leaders in charge and see if we can make the school environment much healthier for everyone.
Thank you so much, Bronwyn. So as we conclude today's webinar, I'd like to extend my sincere appreciation again to Bronwyn and Mohamed for sharing their time and insights on this topic. We hope our attendees have found the discussion valuable and informative. Jeff, sorry we did not manage to get to your last question, but I'll pass them on to Mohamed, and he'll be in touch with you soon. If you have any further questions or would like additional resources, please don't hesitate to reach out to the Centre for Safe Air. And we look forward to seeing you at our next webinar. Thank you and have a great rest of the week. And I think, Bill, you just
Oh, I also just wanted to acknowledge the fabulous work of Sabrina in running this webinar. This will be the last webinar that Sabrina is chairing for us, sadly, going on to great things, no doubt, but it's been fantastic, your work. So really appreciate you helping us with this, Sabrina, and thanks to our speakers today, of course.
no, thanks,
Yeah.
Bill.
Thanks very much.
Thank you.
All right, bye everyone.
Bye-bye.